Hello, I'm Katie. I'm your CNA. Hello, Megan. Well, to start off with, this is a feeding lab. I am going to be feeding our resident, Megan. First, we usually start off with wipes, which is wash your hands, which I did. I identified it, the resident, or in other ways, patient. Then, we provide privacy, but we're eating in the dining room today and not in the bedroom. Then, I explain what I'm going to be doing. I am going to be feeding you Megan today. There is a grilled cheese, hot cocoa, orange juice, and ramen soup, which is chicken flavored. Then, I start the procedure. And I always cut up the sandwich or whatever that's big into little bite-sized pieces so then the person doesn't choke. And we always use the spoon to feed them so we don't hurt them, because forks are sharp and deadly. Here you are, Megan. Oh, one thing I did forget is I forgot to put the bib on the resident. Are you ready for another bite?
Yeah.
Alright. You are. And every few bites or so, we always make sure they have a drink so then they can rinse out their mouth and be ready for the next food. All set? Alright, I'm going to have some of this ramen. Okay, here you are, Megan. And if the person is blind, you set up the tray like a clock. And so then you explain where everything is, so then they can reach out and grab what they want. Or point out what they want. But if you're feeding the person in the bed, you always make sure that they are sit up at a 60 or 90 degree angle.
I don't want to pause, but I'm hoping that didn't stop because somebody texted me.
Somebody texted you?
Did it stop?
No.
Okay.
Now we have a moment where we have to delete stuff. Okay.
That's right.
And since the cup was hot out of the microwave, I'm using a pot holder. Here you are. Hot?
Yeah.
Okay, we'll leave that to the side for a little while.
Yeah.
I'm going to give her some more food. And you never wear gloves when feeding, because gloves are awkward during feeding. If the person has a hard time swallowing, and like their cocoa or their juice, or even in a purified food, you put in thicket to help swallow or pass a bowel movement. Here you are. And if the person that you are feeding has dentures, you always make sure their dentures are in before you start feeding them. Would you like more juice? No? And you ask them if they want to change what they're eating. Do you want your grilled cheese or your ramen right now?
Grilled cheese.
Okay. just to make sure that they have some independence in what they're doing. So they're not just being fed, force-fed, whatever. And then, when done, you write the percentage of eaten. So we would have put 25 for what she's eaten so far, but I'm stopping early to help explain more. So it's not like 10 minutes of just feeding her. And then you end with your ending procedures. You lower, lock, call bell, if on a bed. You remove privacy if needed. Then you wash your hands and then document. Usually you write like the percentage, 25, which is some of the food, 50 for half of the food, 75 for most of the food, and 100 for all the food eaten. If they did not eat anything, it's 0% documented. And you just put it to the side, and then in lots of places they have like clipboards where they have the resident's name, like it has on here, resident's name and their room number, and you put it on there. How much they ate for the day, for in the morning, lunch, or dinner. Alright, that's it.